Hey guys, welcome to the Journey to Happy podcast. I am Olga, your host, and I am today with our guest, Dr. Priya Prakash, a naturopathic doctor. And before I introduce her to you, I'd like to remind you that there is now going to be a sequence of fertility podcasts where I will be interviewing wonderful women who have been through this experience themselves, who have hope, stories of hope and struggle to share with all of us, things to teach us, wisdom to give us. And I will also be interviewing experts in the field, such as Dr. Prakash, who's here with me today. Let me tell you a little bit more about Dr. Prakash. She's a naturopathic doctor. She's the creator of the Awaken Life Natural Fertility Method here in Ottawa. She helps women and couples optimize their fertility and transform their health through the power of natural medicine. Her practice is exclusively focused on natural fertility treatments. Why, you ask? Because she's been there. She had her own fertility journey for 5 years, trying to conceive. She had 3 miscarriages, and now she sees that as a gift in disguise, because through that profound journey, she was able to uncover the true underlying causes of infertility, and she found her highest level of health and balance. Today, she is the mom of a beautiful boy and a beautiful girl, and she works and supports women through the province of Ontario from her home. So, welcome, Priya.
Thank you so much, Olga. I'm thrilled to be here. Really excited that you invited me to this podcast, and I'm excited at the conversation that we're going to have on this really important topic.
Likewise. So before we get started, guys, I actually found Priya as I was in my own fertility journey. This is 5 years ago almost that I started Googling how could I support my fertility journey. I already knew we had been trying for a while naturally at home and it was not working. And I thought to myself, as you guys know, I teach mindfulness and yoga, and I knew there had to be a holistic way to support my body, as well as going to the doctors, the regular doctor. The regular doctor didn't really have much to offer me at that moment. I hadn't been trying for too long at the moment I went to see him. But I met Priya, and Priya asked me to do food sensitivity test, which was very revealing to me, and it really helped me link the connection between food and fertility, which up to that point, my only connection, I knew food had something to do with my health. I've always watched my food, especially because I was a runner, so I was always trying to figure it out what food will fuel my body better to perform better in running. But I hadn't even considered that food and inflammation could cause some kind of issues with my fertility. So I followed her, and you guys, if you hear my podcast on my own fertility journey, you will hear all the many things that I did do to try to get to this blissful state of pregnancy. But stopping by Priya's office was one of the things I did, and one that was fundamentally important for me in my journey, because I never forgot what I learned out of those sessions in terms of food. So 2 years down the road, actually the last year, Priya and I worked together supporting women through their fertility journey, her as a naturopathic doctor and me as a fertility coach. And we still kind of work in collaboration with each other. I love when I'm coaching women through fertility that they are seeing Priya or a naturopathic doctor if they're not here in Ottawa or in Ontario, because I feel that the work is more holistic that way, when the mind and the body are kind of being taken care of. So my biggest wish for having Priya in this podcast was to share her wisdom with all of you. Whether you have a fertility issue or not, I think that these conversations we're going to have here today are going to be very important to you to keep in mind as you're trying to conceive. Where do we start, Priya?
Yeah, so maybe on the lines of you sharing your story, I can kind of jump in and share my own story. Um, so kind of similar to you, I had a 5-year journey, but just a different one. Just like most of the women that we see, we have so many similarities and yet so many differences. It's such a personal journey, um, and for me, the journey started. I was actually still a student in naturopathic school. I was just nearing the end of my internship, and I had life all planned out. I would, before I finished my internship, I would get pregnant, so that by the time I graduated, I would have the baby. I can have the baby, and then like have my mat leave before I really jumped into practice. And I had all these grand plans of how it all should have worked out, and then of course it didn't. um, and it started off with one miscarriage early on, and that first miscarriage, it happens, and I knew already, okay, yes, miscarriages happen. You know what, let's go with that. It just wasn't the right time. And so I just pushed forward, and I continued to build my practice and graduate and start seeing patients of my own. Meanwhile, still continuing to try and try and try and try. And the longer it got, of course, it's human nature. We start to worry. Some earlier than others, but absolutely, I started having anxieties about what is going on here? What if there's something wrong? Should I get assessed? Like, what should I do? And I thought, okay, I'm a naturopathic doctor. I know a lot about health. I'm gonna just get healthy, right? And I felt like I was, my diet was actually pretty, what I thought at the time was optimal. And I thought at the time that my hormones were balanced. So I kept going. I kept doing whatever I could lifestyle wise to, exercise and eat right and do all the things that we think are right. And so another year passed, and another year passed, and still nothing. And at that point, okay, I had a lot of anxiety. So we finally decided we need some assessment. I don't know if there's something going on here. We need to find out. So we got an assessment through the fertility clinic, and everything was normal. Right? Everything checked off the boxes. Nothing came back abnormal. And we were told that this is unexplained infertility. And sorry, let me backtrack. I had a second miscarriage too in that time. So after the 2 miscarriages, that's when we got the assessment, and we were told everything is normal. Keep trying. That those were just a fluke, and everything's fine. So kept going. Had a 3rd miscarriage, and at that point, I'm like, everything's not fine. It can't take this long to get pregnant, or when I do get pregnant, stay pregnant. And it wasn't just that I got pregnant easily, right? It took like a good year and a year and a half, and to even get pregnant. So there was a lot of waiting in between. And of course, with the waiting comes the emotional roller coaster. And I felt crazy at times, right? Like the obsession with becoming pregnant, and the hope that comes, every month that you're trying, and then this 2-week wait, as we call it, obsessing over every little symptom that your body goes through, thinking, oh yes, it worked this time, and oh, this hurts, I must be pregnant, or oh, I feel a little bit like this, I must be pregnant. And for a little while, it drove me a little kind of crazy, and I needed to put an end to that, because I didn't know when it was going to happen. And at the same time, I realized I can't live like this. I can't keep going through this emotional roller coaster every time I get my period, kind of crashing and becoming down in the dumps and feeling low and depressed because it didn't happen again this month. And at the same time, I also knew that this doesn't make any sense. The fertility clinic is giving me no answers. They're saying everything is normal. But what does that mean? What is normal? This isn't this is maybe common. It happens, but it's not normal. This is nowhere near optimal for going through 3 miscarriages. We even did extensive testing on trying to identify additional causes for recurrent miscarriages. Nothing. Everything came back normal. And so we were diagnosed with this unexplained infertility. And me, of course, being a naturopathic doctor, I couldn't accept that. I couldn't accept that there is nothing I can do about this except keep trying and wait. And so that led me to delve deep into research. I'm a research geek. I have a strong science background. Before this, I did an undergrad and a master's in neuroscience. And so my strong science background led me to say, okay, there must be answers here. And I delved deep into the research, and I actually started finding more and more, or uncovering more and more layers of things that impact our fertility, that are environmental and lifestyle related, that I knew as a naturopathic doctor. Like, I knew that diet affects our health. I knew that environment affects our health, but I didn't quite make the certain specific connections between all of that stuff and specific things related to fertility. Right. So as I uncovered more and more, I actually did additional testing on myself, more specialized testing. Even though my digestion was fine and I was eating healthy, when I did a food sensitivity test, for example, certain foods came back through the roof high, and that I was just eating once in a while, like dairy or wheat. I had cut out most of it, but I was still eating it once in a while. Or eggs, which I ate regularly because I didn't notice anything from it. And I thought, well, eggs are healthy. It's a healthy protein. You get lots of nutrients from it. Let me eat this. It's a good food. But I found out it was maybe a good food, but it was not a good food for my body. It was creating a lot of inflammation in my body. So similar to that, and we can get more into this detail later on, but I discovered more and more and more things that were not okay with my body, that did not create the ideal optimal environment to create a baby in my body. And so in one level, the research kind of floored me, thinking, okay, why didn't anyone tell me about this? Why didn't I learn about this? Why isn't the fertility clinics talking about this? And on another level, it didn't surprise me because these were the fundamental things that I had been taught in naturopathic school. I just wasn't making the connection and applying it towards fertility. So my journey really led me to understand a lot more about what I like to call now the hidden causes of infertility. The things that no one talks about, no one tells you about, no one tests for, that are hidden. It's not so obvious. And I checked all of those boxes. So I took some time to say, you know what? Okay, I'm not going to just continue to proceed along this let's keep trying and not do anything route and stress out about it. I'm going to live my life. I'm going to, as is, but at the same time, I want to get healthy. I want to get all of these things balanced that are not balanced. And that was a huge shift for me, mentally, emotionally too, because it put a break for the constantly trying and becoming disappointed all the time.
Podcast on just that subject.
Sorry?
I said we can do a podcast on just that subject.
Yes, absolutely. Absolutely. Because it's not serving you to go through that roller coaster up and down. And I would say for maybe half of my journey, or maybe 3 years out of the 5, I went through that. And then the other 2 years was a complete transformation because I was taking control of my health in a whole new way, discovering things that I knew, okay, yes, I can do something about this. And I was seeing the changes. And at the same time, from more of a spiritual, emotional level, I decided, okay, I don't know when it's going to happen for me. I can't control that. There's my timing and then there's universal timing. And I decided my timing is not the thing that's going to control this. So I let go of all of that. And I surrendered fully to what needs to be done right now, what is showing up for me right now. And what was showing up for me right now is that not all of the pieces of my health were in balance to to be optimal for fertility. So
I
that
think
showed up, and that's what I went with. And ultimately, I got pregnant again after a long wait, and I was still scared that I would have another miscarriage, but it ended up in my beautiful son, who is now 5 years old. And, you know, and at the same time, I, in my practice, became so focused on helping other women, other couples going through this, because during the time where I knew that, well, it's not happening for me, I could at least put my efforts in helping other people. And I also didn't want to abandon that whole community, right? I felt like, okay, I learned a lot from this. I want to, like, it's almost like my mission now is I want to share this with the world, share this with the people who are not getting this information from conventional means of fertility assessment. And I want people to know that there's more to it than just the standard tests that are done or the standard evaluation. So that's my journey right now. Is, you know, I have two beautiful kids. That part of my life is continuing, but that fertility journey has now transformed into, I want to help others go through the same.
thank you so much for sharing your experience, Priya, because I find that a lot of times as we're going through this journey, we're seeking professional help. And I never know, like, I think there's a stronger connection when we know that person has kind of gone through what we're going through, maybe not identically the same conditions, but it's an extra layer of understanding. And I know even for me as a fertility coach, had I not been through it, I don't think I would understand really the frustrations, the pain, the losses, the grief, the impatience. And you talk about surrendering. I think that maybe that's a 5-year thing, because I finally landed to that place of surrendering, where it was very genuine. I was honestly surrendering to the experience and letting go of that control that I was trying to keep so tight prior. And I think that that's such an important power for other ladies listening to this podcast to understand. We did not arrive to that surrendering place and acceptance and mental freedom in a way, and emotional freedom to accept what we were going through overnight. It took us a long time. And I think part of Dr. Priya and myself coming together as professionals, supporting women that may be going through this, is hopefully so that they get to that place sooner than what it took us. Yeah. 5 years is a long time. And I think that that's one of the things that I love the most about working with you, Priya, is that you understood it could take a long time, and that you made me curious to find out what else could be playing an impact. For those listening, I too had the diagnosis of unexplained infertility, my husband too, every single test, and we have done extensive testing, genetic testing, like all kinds of testing, has come back with quote unquote colorful, and like, I think that's the last thing that the doctor told me, like, you pass with flying colors, is what I've always heard of every single test, which in one hand makes me so happy, but in the other one so frustrated, because then why are we not conceiving naturally?
Yes.
And if I think back, the main change I did before this conception was my food. I was so strict about what I was eating. You mentioned no symptoms, and I really want to talk about this for a moment, and maybe this can lead us into what the hidden causes of infertility. Mm-hmm. But one of my surprises was that I'm highly intolerant to eggs, which, like you, I was eating them on a regular basis. Like I mentioned, I was a runner, so my favorite breakfast was 3 eggs with a bag of spinach. I would make an omelet and eat that. Like, I feel like I was having the healthiest breakfast ever. And although I did notice I was bloated after breakfast, I just assumed that my body was always bloated after eating. That because I couldn't point what spinach is going to give me inflammation or eggs. Like, that just didn't make sense, because there's quote unquote great
like a really healthy breakfast.
Yeah, it's a healthy breakfast. Or when I would eat oatmeal, same thing would happen. And so, like, I think nobody can say these are unhealthy foods, but for my body, they were not healthy. And I wouldn't have picked that up ever had it not been for this test that showed the high levels. Like, I had a high close to 100, I think, for eggs,
Yeah.
which is crazy high. Well, you're better to talk about that, but higher than what I thought will ever show up. I will leave it at that. So I want, and I never felt sick. I always had my periods every 28 days. I never had a miscarriage. I have never had a symptom that would have led me to believe that there was anything in my environment, in my food, that could be leading to infertility. And I think many of us are diagnosed with unexplained. And even the ones who have a diagnosis, we focus so much on that diagnosis that we stop looking at all these other very important aspects. So I think that not having symptoms doesn't mean that everything is working optimally in the body.
Exactly. That's exactly true. Yeah, the absence of a diagnosis doesn't mean that everything is normal. It just means that we don't know what is going on. So the most frustrating thing about unexplained infertility, it's almost given as a diagnosis these days, just like IBS, right? Like irritable bowel syndrome. It's one of these kind of catch-all diagnoses that is given to so many people when they have digestive issues where they can't explain why it's coming. Or
they don't know what it is, so they have a fancy name for saying we don't know what it is.
Yeah, exactly, right? And unexplained infertility has become this, and I mean it's in the name that we don't know what the reason is, but it's frustrating because it's just left at that. And then the only other solution after is, okay, well, we could try IVF, but sure, great, do IVF, but how about before you spend tens of thousands of dollars, why don't we dig a little bit deeper and see if there's anything else, right? If you don't do the testing, then you're not going to know the answer. And you can bet that not all of the testing is done in the conventional fertility world. Much of it is done, yes, and I totally respect everything that is done. It needs to be done. Yeah. So for those of you out there who are experiencing infertility and haven't yet gone through a regular conventional fertility assessment, do it. It's important. It's important to have the conventional side of things. But at the same time, there's certain things that they're not really going to care about, right? So there are many patients who have really bad digestive issues. Like you can have diarrhea every day of your life, and you tell that to your fertility doctor, that doesn't really matter to them. That's a separate issue, right? It's, maybe you need to go to a gastroenterologist or your family doctor for that, but it's not related to fertility. And my opinion on that is that is exactly the opposite, is that the body works as a whole, integrated unit. You can't separate your uterus and ovaries from the rest of your body and look at it and evaluate and say, hey, everything is normal because we looked at these organs and we can't find anything and therefore it's normal. It doesn't work that way. You can't separate the reproductive system from the digestive system or the immune system or your brain or your heart or anything. Everything works as an integrated unit. And when something is wrong somewhere else, it has a ripple effect in some capacity, will affect everything else in your system. So if you do have digestive issues, it will impact your hormones. And if you have hormone issues, it will impact your fertility, right? We actually metabolize a lot of estrogen in the gut, in the digestive tract. And so to say that digestion is not related to fertility and hormones makes no sense at all. They have a direct impact. And so we want to look at all of the systems as a whole and individually to see where are the imbalances everywhere else and how could that potentially impact fertility, right? So when you talk about the no symptom thing, there is, actually no symptoms, but sometimes it's just that, yeah, maybe you don't have any direct fertility symptoms or reproductive symptoms, meaning your cycles might be normal. You might not have any, ovulatory dysfunction or anything like that is symptomatic of fertility issues, but maybe you have some digestive issues, or maybe you have headaches regularly, or maybe you have some skin issues. So those are separate systems, but they're symptoms that indicate dysfunction in your body. And when you look at dysfunction anywhere in the body, you can tie it back to how could that impact your hormones and fertility.
I think that's key. I'm also thinking of people who may have already some health anxiety and listening to us talking about there might be something, you just don't know what it is. If that is setting off your anxiety right now and you're thinking like, oh my God, how do I find out? There's no reason to panic. The less panic you have, the better it is overall for your body. We're simply suggesting that every system in your body is interconnected and every system in your body needs of each other to function optimally. Yes, we can look around and say like, well, this person doesn't look so healthy or doesn't have this healthy and they managed to conceive. Okay, so that person's condition didn't really impact their fertility, but it may be impacting their brain functioning or their other system functioning. So all we're suggesting is there are ways for you to get a better understanding of what's functioning in your body and to what degree is functioning. And the interventions that a doctor like Dr. Priya would suggest to you wouldn't be exclusively only to a type of person. I think that your interventions are open to anybody can listen to this. Anybody can improve their overall balancing of their body and functioning of the body. And so I don't know if you want to add something to that, Priya, but I just wanted to make sure that the people who are listening, in case you already have anxiety, that there might be something that was definitely me, like unexplained didn't mean anything to me. And like, there is something, you just don't know what it is. But I was very much focused on my fertility. And it turns out that it had nothing to do with my fertility systems or my husband's. For us, it was definitely, I think, I mean, this is still a guess, but what we changed the most was our environment, the products we were using in our home, plus the food. We became really, really strict at not eating the foods that were causing inflammation in the body.
Yes, and to add to what you mentioned before about, yes, one of the frustrations a lot of women or people going through fertility challenges is, well, there's some people that we see that they smoke and drink and use all the bad toxic stuff, and they do all the things that we shouldn't be doing, and at the drop of a hat they just get pregnant, right? Yes, that's how it works. But it's really about an individual, right? Our bodies all function very, very differently based on our genetics, based on our environment, based on what we put into our body, and our system will respond to the environment very differently because we are different individuals. And so, yes, some people, smoke cigarettes all their lives and don't get lung cancer. Doesn't mean that smoking and lung cancer are not associated. Yeah, of course they are linked, but some people may have the genetics that allow them to do those things and not be affected by it in that particular area, whereas other people, secondhand smoke causes them to die. That's an extreme example, but similarly with respect to fertility, it's kind of the same thing, right? Yes, there are people that drink and do all the bad things that we're not supposed to do for fertility, and they have no trouble conceiving. Does it mean they're healthy? No, that's going to catch up to them. It will impact them. We just don't know how. What's going to happen to their body? Are they going to get cancer? I don't know. Time will tell. And then some people, it's going to impact our hormones, right? Some people, it's going to impact their digestive system, but not their fertility. So it's very individual.
Yeah. So that's a really key point. We were talking about like hidden causes of infertility, and we've touched obviously already on a few here.
Yeah.
Would you like to just briefly mention some of the other causes, hidden causes? So I'll label them now, the ones that we've spoken about, or you want to label them?
I can go through them. So kind of, I like to categorize it into kind of 4 hidden causes of infertility. And there's many more, but these are kind of the most common. So food is the number one thing, which we've already touched on. It's the food that we eat, but also the impact that it has on an individual in terms of our gut health. Our gut is such a central system in our body. We call it the second brain because it has hundreds of thousands of nerve endings and connections, direct connections and interactions to the brain. And when things are not optimal in our digestive system, whether you have symptoms or not, and that's key to what we were talking about before. So you may have bloating, gas, diarrhea, constipation, or you may have none of those and have seemingly perfect digestive health. But what's happening underneath in terms of your actual gut health may or may not be visible, but is really critical, because hormone production is affected, inflammation levels are affected. All of that is going to impact our fertility. So food and digestive health is the number one. Number two, I would say, is environmental toxins. We live in a soup of chemicals. If you're a human being living on planet Earth, which I think everyone listening out there are, you are toxic, I am toxic, the babies growing inside of us, unfortunately, are also toxic, because it's everywhere. We have sources of toxins from the food that we eat, the air that we breathe, the water that we drink, the products, and just it's just everywhere. And so we can't avoid it completely. We can't unless we live in a bubble. And that impacts it can trigger inflammation, which can damage our growing follicles and sperm cells, right? They're very, very susceptible to environmental toxins. That inflammation can then trigger hormonal imbalances. So it's a cascade of events that happen as a result of being exposed to these toxins. And then, of course, it affects our liver health. Our liver is the organ that detoxifies and breaks down toxins. But if there's way too much coming in, it cannot process everything. So the liver gets really bogged down by processing all these toxins. And one of the major roles of the liver is also to actually process our own hormones. When we make a hormone, we actually have to get rid of it. That's the liver's job. And when it's too busy processing toxins, it doesn't do its job processing the hormones that we need to metabolize. So, it causes some hormonal issues.
Right.
Number three would be stress. And to some, that might be an obvious one, and to others, not so obvious. We're all stressed day to day, whether you're going through fertility issues or not. It's just sort of the type of lives that we live today. We have work, we have financial issues, we have commutes, and we have family and relationships to think of. We have a lot on our plate. And so aside from the actual fertility stress, our lifestyles today are stressful. And when we are chronically stressed, which most of us are, from growing from school to work to just busy lives, it impacts our hormones directly. So cortisol, which is released by the adrenal glands, has a direct connection to the ovaries in women and to the testes in men. And it has a direct kind of reciprocal relationship, where when cortisol is too high or too low, it will directly signal to our ovaries or testes to change and shift our hormonal production. And so that then directly impacts our fertility. Mm-hmm. We can delve into this more later. And then the fourth one is not so obvious, which is what I like to call suboptimal hormones and nutrient levels. And what I mean by suboptimal is that when we get tested on a regular blood test, let's just take iron as an example. It's a common test. There is a lab range of what we call normal, okay? And usually, typically, when you fall within that normal range, anywhere within that range, the doctor tells you there's nothing wrong. You're normal, your iron levels are normal, there is nothing wrong. Meanwhile, I would say almost most women are walking around with low iron levels, but it falls within the normal range, so nothing ever triggers the doctor to say, hey, maybe you need to take an iron supplement. And that's because there's ranges within that normal range of what we like to call the optimal range, or medically speaking, the functional range. So there's that optimal range, and then there's this wide, narrow range, which falls within the whole population of what we consider normal. And I don't know about you, but for me, I want to be in the optimal. I don't want to be just okay, right? Just okay is just about survival, right? Like, you're good enough to live, but that's not good enough to optimize your health and to bring you to your highest level of health. And, something as simple as suboptimal iron levels has a direct impact on fertility. And similarly, all of the nutrient levels, your vitamin D, your B12, everything, and hormone levels as well. There is normal and optimal. And I like to bring my patients and keep myself in the optimal ranges. And I can't tell you how many times I review records that for all the testing that has been done, and the patients are told that everything is normal. And then I take another look at it through a different lens, the lens that is looking for optimal. And I'm looking at it and I'm saying, wow, no, this is not optimal. It's okay, but it's not optimal. So that's another key area that I tend to focus on, is we need to bring everything back to the optimal so that you're giving it your best chance. You're giving it the best environment that is conducive for egg and sperm to meet and successfully conceive.
So do you in your regular practice then recommend testing that maybe a fertility clinic or a regular doctor may not be suggesting?
I do, yes. So a couple of common tests, for example, one that you already talked about, which is a food sensitivity test.
Yeah.
And not just any, I should mention this, being a podcast, there are lots of food sensitivity tests available to the public that are relatively cheap, but believe me, there are huge differences in the type of testing, and they're not all equal. And I've seen many people just pay money randomly to get some test that they see online, to look at the results and just not quite understand what it means, because it makes no sense, right? And so there's a quality of test, and so I can't emphasize enough that you should be getting this testing through someone qualified, like a naturopathic doctor. So that's one common test that I do to uncover what are the foods that are triggering inflammation in your body. These are not allergies, just to be super clear. These are not food allergies. That's a very different process. Food sensitivities are a different type of reaction in the body that's delayed, meaning you can eat the food and not experience any symptoms for even 2 to 7 days after ingestion of the food. All it does is it triggers inflammation, and that inflammation can be totally silent. You can feel nothing. It's just the accumulation of that food inflammation over time can cause dysfunction and imbalance in the body. So I typically test. It's hard to guess, right? Like in my situation and yours, I was eating eggs all the time. I kind of suspected that I had a dairy and wheat intolerance, but eggs I never suspected until I saw the test. It was through the roof high. I cut it out, and all of a sudden I did notice, oh wow, I feel better. And I didn't correlate certain things that I was experiencing with the foods that I was eating until it was free of my body. So that's
my eczema went better after I stopped eating eggs.
Mm-hmm. Yeah, absolutely.
So,
and then another test would be different type of hormone testing. So blood tests, nothing against blood tests. There is a time and a place for blood tests, and for the vast majority of things, they're quite reasonable and accurate. But when it comes to certain hormones, blood testing is actually quite possibly the most inaccurate way of assessing certain hormones, like let's take estrogen, for example, and progesterone too. So those are commonly the way that estrogen and progesterone are assessed. But the thing about the blood tests is that those hormones, in order to be in the blood, need to be bound to proteins. So what we call protein-bound hormones. And protein-bound hormones are not active hormones. They're just what is being carried in the blood at the time. So there's a difference between active hormones that are reaching your tissues and having its effect, and just the ones that happen to be bound to proteins to be carried in the blood.
Right.
And so when you get a blood test, the range for estrogen is so wide that I would say probably 95% of women fall within the normal range. And so they're told, okay, well, everything looks fine with your estrogen. But oftentimes I see symptoms that are very, that I become very suspicious that I think there's estrogen dominance happening here, maybe meaning that the estrogen levels are too high, but the blood test is showing that it's normal or even low normal. So it doesn't quite make sense. So there are other types of testing. The one that I typically use would be dried urine. So urine testing of hormones can give us a much wider range of what is happening. One, they're not protein bound, so they're active hormones. And two, estrogen is not just estrogen. There are metabolites of estrogen, so breakdown products of estrogen. There's actually three major types of estrogen. The standard tests in the blood only test one type of estrogen, are estradiol. And estradiol, also its counterparts, estriol and estrone, are just as important to evaluate. Further than that, they get broken down into other metabolites. And without knowing the full picture, you cannot tell if your estrogen is normal or not. And more often than not, I test and I see, wow, estrone is really, really high. And that's what we call the bad form of estrogen. And it's completely hidden because the blood test shows it's normal and low normal, which is a good thing. But it's only when we do the further testing that we realize, wow, this person actually has estrogen dominance. And that might be the reason why her progesterone is so low, as an example, right? So that's a common test that I do. And even on standard blood work, for example, thyroid or TSH is typically the standard test that is tested on the initial round of testing. TSH can fall within the normal range or even the fertility optimal range, but T3 and T4 might still be abnormal, or thyroid antibodies are elevated. So what I like to do is a full thyroid panel, which is not typically done in the conventional assessment. Even if your thyroid comes back perfectly normal, you may still have thyroid issues. And the only way that we can know is by testing
Right.
to evaluate the other aspects of thyroid function.
So the best way to get this test done is to go see a naturopathic doctor.
Essentially, yes. Yeah. Someone who is qualified to do tests and interpret them.
And you specialize on fertility only. So does that mean women who are looking at being supported by a naturopathic doctor as they're going through the fertility journey should be ideally searching for somebody who specializes only in fertility, or does a regular naturopathic doctor can help with fertility?
The principles are all the same, but honestly, the world of fertility has some specific, there's some intricacies in this world that unless you have a focus or practice focus in this area, that might get missed, right? So I'm not saying that seeing another naturopath is a bad thing. Chances are, by seeing any naturopath, you would have some improvement in your digestive health and a closer look at your hormones and to do appropriate testing. What I'm saying is that when you're seeing someone who has a special focus in this area, the eyes it's just a different lens, right? Having the experience of seeing thousands of different tests over and over again over time leads me to be able to question things that other people may not question, or go to places, go in the right route that other people might not.
Right. So you're basically like an investigator. You're just trying to figure it out, what happened where, or what's happening where, and how to then create a plan to support women through, and men and couples through that journey to optimize their chances of fertility.
Absolutely. Yeah. It's kind of like the body's a mystery and someone needs to be the detective to investigate what are all the things that are out of balance in your body, whether or not they are directly related to fertility. And the idea is by supporting the body through dietary changes, environmental changes, stress management, getting on the right nutrients, vitamins, herbs that are tailored to the individual, we're creating the right environment. And it takes time, right? This isn't a magic pill that you swallow and then 1 or 2 months later, boom, you're ready for IVF, or you're ready to conceive. It takes months, right? If not even longer than that, especially in your journey and mine. If you've been eating a food, like in your case, gluten, for so long, it's not just removing it for 2 or 3 months is not going to, not all of it's going to help, but the full impact of it is only going to show up a few months down the road, right? And that was my journey too. It wasn't just this magic, like, oh, here's this food, I cut it out and then boom, I'm pregnant. No, there was layers to peel.
Which I think that's such an important message. And I remember listening to you say like, no, you got to stop this for months before, and thinking like, I don't have time. Right? Like, I've got to rush to my next treatment. I have to do this now. Nobody was imposing the rush other than myself. And you said it best. I had my own timing, and then the universe had its own time. And I think a lot of the women I work with, I help them change their mindset to become more accepting and more patient of this system, very, very complex system that's our body. And I think there's a great book for anybody listening to this who I personally believe every single human who's trying to conceive should read. It's called It Starts with the Egg by Rebecca Fett. And she is another person who will so clearly explain the process of that egg developing and how long it takes for that egg to develop. So the eggs you have today that are about to just hatch and come down the tubes were matured 3 months ago, or having that process of maturity. And so our thinking and our timing does not even match the reality of our body's timing. And I think that that's such an important concept as you're going through fertility treatment, whether you're in fertility treatments with a fertility clinic, or if you're just trying to improve your chances and you're doing everything at home because you don't even know if there's going to be a problem, is to understand that the vitamins, the supplements, the testing, everything that you're doing is providing you with information. Then you have to begin to do the changes. And like Priya was saying, you will see those changes show up in time. But your body will take its time to readjust, to kind of like undo the things you've been doing for years and didn't even know. Like I joke, my husband and I joke about this. It turns out that we noticed throughout my last IVF treatment, I've done a total of 4, that I was intolerant, or before the last one, that I was intolerant to, not only intolerant to gluten, which I already knew through doing Dr. Priya's blood testing for food sensitivities. And I mean, I was always bloated after eating anything with wheat. But we found out that I have the gene of celiac, the celiac disease. And while I don't know 100% that I have the disease, I have that gene. So I'm more prone and more sensitive than another human around who doesn't have that gene. And my first IVF, after every single appointment, my husband and I would go celebrate, whether we had good or bad news. After every single appointment, after every single ultrasound, we will go and eat at Kettleman's Bagel, which for those of you who are not know what, they're amazing. Just bagels that are delicious. So now we think back, our chances of conception, knowing what we now know about my body, were so reduced, obviously, that did not end up in something successful. So I think back of just those little decisions we make, not knowing the impact that it's having in our body. You know, there hasn't been, I haven't, and now to make the changes, once you understand the impact in your body, because some of you may have the perception of food with diet linked, and then maybe you feel that diets are restrictive and they're terrible and you don't like them. Maybe because some of us have that relationship with food where we love eating and we just don't want anybody to tell us what to eat, and we find it constricting and difficult to go into a nourishing diet for the body. And I want to tell you that how I understood the impact that food was having in my body, specifically with relation to inflammation and understanding the impact of inflammation in the body, it became so simple to just make better choices. It didn't feel restriction. It felt like it was a no-brainer. Why would I eat bagels if they're potentially the cause of why I'm miscarrying, not keeping pregnancies, or not conceiving? So
yeah, and it's that understanding, right? It's knowing, it's understanding the why behind this. Why is this important? Which, simply being told to cut out of food, it's hard. It's really difficult when you're not understanding what impact is this going to make, like the mechanistic reason why this inflammation is bad for you. And I think books like that you mentioned and podcasts like these, or knowledgeable practitioners that you trust, it's a really important part of your journey. Because if you just read something on the internet or just cut out gluten because Olga said it helped her,
Right.
that can't be the reason, right? You need to really understand how it's impacting you and why this is important for you as an individual, right? Because it might not be gluten for you. It might not be eggs. It's really individual, and that's important to understand. And then along the lines of timing, like you said, a personal story for me with respect to how long it can take to notice changes from removing foods. I feel like I'm somewhat of an extreme case, but for years and years in my teens and my 20s, I used to have terrible sinus congestion. I was always congested, recurrent sinus infections. And for years, people told me it's dairy. Cut out dairy. You eat too much cheese. You need to cut it out. So I did try it out for 3 to 4 months at a time. And I'm talking strict, 100% solid, cutting it out. And I noticed no impact whatsoever. And I loved cheese. And so I thought to myself, well, why am I going crazy trying to eliminate this? I'm going to eat it anyway. And eventually when I learned that, okay, maybe these foods aren't great, I did minimize it, but I was still eating it maybe once a week or so. It wasn't until I did the test that I saw, wow, these dairy and many other foods were through the roof high, very inflammatory for me. So I cut it out on my fertility journey even more strictly. And I knew just from the understanding of why inflammation was bad for me, that was enough to keep me going. And the goal, or I should say the motivation of wanting to bring my body into balance in order to get pregnant and stay pregnant, that was motivation enough for me. But what I learned in that process was 9 or 10 months into eliminating those foods strictly, my sinuses cleared. 9 months, 10 months, not 3 months or 4 months or 6 months, 9 or 10 months. So I thought, wow, finally, okay, something's working. And I really was convinced that it was gluten or one of the other foods because I had tried eliminating dairy before. But what I learned after, so about 1.5 years after complete elimination, I started experimenting with reintroducing foods. And I learned that it was dairy. It was dairy that was causing the sinus problems. It was just that there was so much inflammation that I had to eliminate it for so long that allowed the inflammation levels to go down. And 3 months wasn't enough for me. And I lived that way. Like, it's not like I had some drastic improvements in the first few months. What had to motivate me was the knowledge and the understanding that inflammation is not supportive for pregnancy. Yeah. And therefore that was the goal or the motivation that I had in my mind to stay away from those. But the bonus of it was I learned that the timeline for how long it can take to improve symptoms or to really bring the body to optimal can be a lot longer than we want.
Yeah. So one last question to you, because I think I hear a lot of my clients ask. So I ask every single one of my fertility coaching clients who's their team? Like, who are they surrounding themselves with in terms of professionals to help them conceive? And most times than not, they do have a fertility expert of kinds, like they're in a clinic, or but not all of them are seeing a naturopathic doctor. Not all of them are seeing a nutritionist. There's always there's always like everybody has their own team, and I find that sometimes there's a misunderstanding of what a naturopathic doctor can do to support their fertility, or that they feel if I'm seeing a naturopathic doctor, then I'm not seeing a regular fertility doctor. And in my experience, it was personally, for me, it was the combination of all these people in my life that really helped me. I almost felt like my fertility journey was like this massive puzzle that I just had to put all the pieces together. And I learned something from every professional. And I encourage all of my clients to go see a naturopathic doctor just to have a checkup, just to make sure that things are exactly as they think they are, functioning or not functioning in their body. What are your thoughts? Obviously, being a naturopathic doctor, I know people who say, well, this is biased, but can people be supported through a naturopathic doctor while they have decided that what they're doing is IVF, or what they've decided that what they want to do is completely natural? Like, what would you say?
Absolutely. And I agree with you that it takes a team of professionals to, I don't think there's any one individual professional that can do it all, right? We're not experts at everything, but we are experts at certain aspects of health. So I think it's definitely important to have a team of experts that are experts in their own field and put all of those together. I had a team in my journey too. It wasn't just the naturopathic stuff. It was, also the mindfulness piece. There's lots of different people who helped bring one of those pieces together for me. But with respect to your question about, whether do you want to do this naturally or do IVF or don't know, all of this can work together. You don't have to do just conventional or just naturopathic. It's not one or the other. They work really well together. And in some cases, you're going to have a fertility clinic that is super supportive of naturopathic medicine. There are many out there. And unfortunately, there's also equally clinics that are not supportive of anything natural. But it doesn't mean that you shouldn't do it, right? You, as a patient, you have a client, you have a right to take your health in your control, and choose who your providers are, given that they are experts in what they do. And so I do encourage people to see both, right? Because, I can't do ultrasounds, for instance. I don't have all the answers. There's certain testing that needs to be done on the conventional side. Whether or not you want to do IVF, people have this misconception that if they go to the fertility clinic, that it means that they are going to do IVF. It's not. Just, you can go for their expertise in doing an evaluation, right? Doing all the basic testing is really necessary. Even for me as a naturopathic doctor, I always request files, right? Because I need to know what, do you have a big fibroid growing in your uterus? Like things that I can't test for. And at the same time, then I can see what has been tested and complement that and support that, to get a bigger picture of what is going on. On the flip side, if you decide, no, I don't want to do IVF, but at least you have the evaluation, well then yes, you don't have to jump to IVF. If you're able to spend some time to make the necessary changes, and if you're willing to surrender to not having a timeline, right? And go through the process of just simply refocusing on getting healthy and balanced, creating the right environment to support pregnancy. I would say usually that's a period of about 3 to 6 months of solid effort. After that, trying naturally can take time, right? It can take 6 months, it could take a year, and that's still normal, but at least you know that you've provided the right environment. If one chooses to do IVF, which many do, and there's no judgment on that, it's a great tool to have. But my one, I guess, thing about doing IVF is that if you're going to either use up your funded cycle or shell out $10,000 to do this expensive procedure, be sure that you've done everything else to support your body, right? Don't just rush into it. A lot of people are stuck in fear. Mm-hmm. When you're stuck in fear of what if I never get pregnant? What if I never become a mother? What if, everyone else is getting pregnant but me? And that fear makes people make decisions that are not in their best interest and not in their highest, because it's driven by fear, right? And that means that you might make a decision to do IVF at a time where your body is not ready to do IVF, right? Yes. So I urge people to step back and do the work, right? Seek the right help, do the work, make the changes, clean up your diet, clean up your environment in terms of what products that you're using and getting rid of all the toxic stuff, get your hormones evaluated, do the acupuncture, do everything that you can do with a team before embarking on IVF. And the chances of IVF succeeding are much greater when you're providing the right, healthy eggs, healthy sperm, and a healthy uterus to implant in. And that's my biggest piece of advice for anyone going through this. But yes, there is a varied team. In addition to a naturopathic doctor, I always recommend counseling, coaching, right? It's important that people know that they're stressed during this, but what they don't understand, there's a lot of people that think, okay, well, I can handle it. They have ups and downs and they think that they can handle it on their own. But it's the tools, the specific tools and tips and tricks that are so important to keep us going, right? To prevent us from being triggered every time you see someone's pregnancy announcement. So that's one part of like my super team. There's other people like acupuncturists and then of course the conventional fertility doctors. That's really important as well. Sometimes people need to see, for example, a pelvic floor physiotherapist for women who may have structural issues within their uterus, or someone who might have endometriosis or anything like that, where that can be restricting proper blood flow and circulation to the pelvic region, or secondary infertility. Absolutely, when you've already had a baby and are trying to conceive again, but not quite working out, often there are structural issues. So there is a wide team, and we need to recognize that it's not just a one treatment approach that's going to work for everyone. It's usually a combination of everything working together in a safe way.
Yeah. So I think even to add to that is just for people you listening, recognize what aspect of your overall health and well-being is needing some support, and then looking for that. Because I think that being supported is a huge part of this process and is what's going to make this journey far easier on you. This journey is already so difficult, so it's trying to make it easier for you. Priya, before I let you go, I have a couple of questions here from some of the ladies in our free fertility support group, which I encourage everybody to join. It's through Facebook. Everybody can join. It's exactly as it stated, support group, women from all walks of this fertility journey coming in here to ask questions and to support each other. And this one says, I have seen a few questions floating around different groups that are about the safety of supplements while trying to conceive and while being pregnant. Folic acid, B12, etc. The typical answer I get from my doctor is not enough evidence, so best not to take it. But there has to be some information on at least one of these, right? So she's wondering if you can talk about the safety of some supplements while they're trying to conceive and while pregnant.
Yes, absolutely. So the ones that she touched on, folic acid, I actually have a lot to say about that. I'll try to keep it brief, but the optimal form of that vitamin should actually be folate, not folic acid. So folic acid is the synthetic version, and our body actually has to convert folic acid into folate. Folate is the active vitamin that our body needs. And so for anyone looking for a high quality prenatal vitamin, look at yours and take a look. Does it say folic acid or folate? Folate, or methylfolate as it might be called, is actually a much better quality, more like the active form. It's going to have a greater impact. As far as the safety goes, there's many research studies supporting the safety of basic things like folate and vitamin B12, prenatals, that kind of thing. But it's a very large topic because there's so many different types of vitamins out there, right? So my advice is that most people out there should be seeking help from a naturopathic doctor, someone qualified in looking at vitamins. The thing about medical doctors, nothing against them. They're really great at what they do. It's just that they have zero training in this realm. So nutraceuticals, vitamins, herbs, things like that. They don't have experience in it or any formal training in it. And so from a safety perspective, of course, they're going to say there's not enough evidence. I can't recommend that. That's to cover them, right? Because they don't have the experience or training. But there are many vitamins and herbs, nutrients that are okay to take equally, while trying to conceive, but equally there are many things that are not safe to take during pregnancy, right? So there's, some that I will never put people who are even trying to conceive on, right? Like vitamin A, like the actual retinol form of vitamin A, I wouldn't put someone who's pregnant on it, who is trying to conceive, because it can, build up to toxic levels. But then certain basic vitamins are totally fine. And then there's this in-between category where I will have patients on certain herbs, let's say, while they're trying to conceive, that I know are not going to be harmful to a fetus in the few weeks that they may not know that they're pregnant if they do successfully conceive. And when we find out that they're pregnant, we just simply take them off, knowing that there wasn't any harm done. It's just that we want to minimize what is taken during pregnancy. So
bottom line to that question would be consult with, because it's hard for you to even say, from what I was listening to you say, it might be safe for some people with their specifics.
Yeah.
And maybe for others, not so much, but folate and B12, generally speaking,
and using the higher quality versions of them is important. And yeah, getting that answer from someone who's actually trained in this, rather than getting the answer from someone who just simply doesn't have that experience or training.
Right. The other question is, in preparation for a frozen embryo transfer, any recommendations to help improve lining thickness and receptivity?
So there is a supplement for that I typically recommend. Again, this comes with a blanket statement that ideally, honestly, you should be getting advice from your healthcare practitioner about it, because I can't say for certain that this is safe for you as an individual. But what I do recommend often is something called N-acetylcysteine, which is a supplement that, so N-acetylcysteine is a precursor to something called glutathione, which is an antioxidant in the body. And I do use it pre-transfer, just in infertility, because it can help with egg quality, insulin regulation, many things. But also it can improve the lining thickness, and has been shown to potentially, from a theoretical perspective, can support implantation. And there has been quite a bit of research showing that it can reduce the risk of miscarriage with those with a history of miscarriages. So N-acetylcysteine has been established in the research, at least, has been established to be safe in pregnancy. Although I just wouldn't take it unless it's under the advice of someone. Also, to make sure, because there's, especially when going through whether it's frozen embryo transfers or IVF, there are many varieties of medications that you may or may not be taking. And so it's difficult to assess as a blanket statement saying, yes, it's safe, or no, it's not safe, because it all also boils down to the individual, depending on what you're taking and what may or may not interact with it.
Okay. So I hope that answers the questions to the ladies who were asking them. For anybody else who's listening to this podcast who is in the province of Ontario, right, Priya, you can see anybody?
Yes, I see anyone in Ontario. Yeah.
You can contact Priya at?
So my website is awakenlife.ca. And you can contact me through there. Our email address is there. My Facebook and Instagram handle are there, so you can connect with me through those social media outlets as well. And yeah, those are the best way to get a hold of me, for sure.
And if people are not in Canada, they're not in Ontario, can they still get a consult with you? Can they chat with you? Can they book a session with you?
I would start off with what I call a discovery session. It really depends on where they are, based on regulation, right? So, naturopathic doctors are regulated in certain areas, state by state in the US and different countries. So there are certain areas that I would not be able to treat certain people, even for a consult. And there may be others that I can, because those areas might not be regulated. So it's highly individual. I could say for sure Ontario is a safe bet. Anywhere else would highly depend on where they are. So the best thing would be to email us and ask us like, hey, I'm from here. Could I book a session?
Right. What is cool about Priya is that she works through telemedicine, so she's able to work with people remotely. You will see her face to face, like I'm seeing her right now, but you won't be physically at her location, which for those of you who are going through fertility treatments and have 5 million appointments, I cannot tell you how much this saves the hassle of like commuting and taking time off work necessarily. You could be doing this at your lunch hour while you're sitting in your office and just consulting with her. So thank you from the bottom of my heart, Priya, so much for joining the community and for coming to talk to us about this very, very important subject. I think that you and I need to do another podcast at a later time and just talk about what it's like to be in the field of helping people going through what we experience. And just before we started recording, we were talking about like the anxiety of being pregnant after infertility and the anxieties after you give birth. And, you know, there's so much to talk about and so many subjects in which we actually, for those of you listening who don't know, Priya and I do run a free support group once a month. And it's also done through Zoom. So it's done remotely. You can be literally anywhere. For that, we don't have restriction of where in the world you are. We could, as long as the time makes sense for you, you could join us. The best way to find out information about that is through either of our Facebook pages. So either through my fertility support group, that's where I post information, or through the Awaken Live Awaken Live Facebook group and page. We will be posting them. We have them once a month. They're typically held at night, 6 to 8 or 6:30 to
30 to 8:30, yeah.
6:30 to 8:30. And we often bring guests, or Priya or myself have subjects prepared to discuss. And we have a great community and we want to see it growing. So if you're listening to this and you feel that you're in need of some peer support, join us. Jump in to see when the next one will be. And I really hope that if you're listening to this, you got something important out of it. If you've got more questions, either to Priya or to myself, feel free to reach out to us directly. Also, do me a huge favor and write a review on this podcast. I would love to know how you guys feel about this type of podcast where I bring in experts and we discuss subjects of interest. I want to be able to bring more guests into the podcast, and the only way in which I can do that is by having the greatest number of reviews and little stars under the podcast. That's how we get noticed by others, and that's how people agree to come into our podcast. I'm not saying that about Dr. Priya. Her and I have a working relationship. She was so happy to come and join, but if I wanted to bring other people, that's what they are looking at. So if you like this podcast, leave us a review. If you have feedback, if you have questions and comments, also leave us a review and help us share it. If you think other people need to listen to it, then you can share it. I hope you can join our social media connections so that we can stay in touch. From my heart to yours, thank you so much for listening. Thank you, Priya, so much for joining us.
Thank you so much. Thank you, everyone.